name is Megan McLaren. I'm going to be your nurse today. Can you state your full name for me?
Stephen McCotter.
And can you tell me your date of birth?
April 6, 2002.
All right. We're going to get started with the head to toe assessment. I'm just going to wash my hands first. Can you tell me what month and year it is?
April 2022.
And can you tell me what city we're in?
Pink County.
All right. So my patient is A&O times 3, so I know that I can ask him any questions that I may need to. What's your current medical diagnoses that you have?
I have asthma.
How long have you had that?
My whole life.
Okay. Do you take any medications for it?
I have an inhaler.
Do you know what kind of inhaler medication it is?
No.
Okay, we'll have to look into that. When's the last time you had an asthma attack?
I've never had one.
Okay. Do you take any other medications?
Over the counter, like Zyrtec and Advil, and Advil, cold and sinus, and like Benadryl and stuff.
Okay. Do you have any allergies?
Guinea pigs, penicillin, and mold.
Okay. You don't take any prescription medications for
No.
anything? Alright. Do you follow any certain diet regimen?
No.
Have you had any past surgeries?
Broke my thumb, got my wisdom teeth taken out, and I got my tonsils out.
Okay. Are you having any pain or discomfort anywhere today that we need to be aware of?
No.
Nothing at all?
No.
Okay. Do you have a history of drinking?
Nope.
Do you smoke anything? Cigarettes, marijuana, vaping?
Nope.
Any other drugs?
Nope.
Okay. And do you have a family history of any diseases?
No. Not that I know.
Okay. Alright, well, you answered all my questions, so I'm going to get a set of vitals on you. So we're just going to start with pulse and respiration. So we're just going to sit here for 2 minutes, and I'm just going to have my hand right here in the radial pulse, and we're just going to sit here while I count your pulse, okay? Starting now. Okay, I got 88 for your pulse and 18 for your respirations, and those are within normal limits, so we don't have to worry about that. Now I'm going to put a pulse ox on you, which is just going to test the oxygen saturation in your blood. And before I do that, I'm just going to look at your fingertips and make sure that I don't see any clubbing, and I do not. Ow. Okay, and while I do that, I'm just going to get your temp. 98.4 and 98 for your oxygen saturation. Okay, that's really good. Now we're going to do blood pressure. artery placement. Good. It still is. Alright, I got 130/68, which is a little high, but you're in the doctor's office, you're nervous, so we'll let it slide. Is that a normal blood pressure range for you?
Yeah.
Usually 130s?
Oh, no.
Would you know
It's
what your normal
high.
is?
No.
It's a little high?
Yeah.
Okay. We'll tell the physician about that. So, okay, now that I got my vitals on you, I'm going to fix this. Now that I got my vitals on you, I'm going to go ahead and start with the assessment. This is my blank sheets of paper that I'll be referencing. Okay. So, first thing we're going to do is just look at your muscle tone. So, I'm going to start with the arms. And while I do this, I'm also going to look at your skin to make sure I don't see any moles or bumps. No lesions, no skin discoloration, not seeing any of that, so that's good. And then I'm going to look at your hands, and they feel very warm to the touch. And I'm going to check your capillary refill, which is about 3 seconds, so that's good. And then I'm going to have you squeeze your hands for me, just to test that muscle strength. Good. And now I'm just going to push on, I'm going to have you hold them out for me, and then I'm going to push down on your hands, and I want you to resist. And I'm going to push up. And hold them like this. I'm going to push in. And I'm going to push out. Okay, good. Now, can you move your shoulders in circles for me? Good. Can you move them forward? Okay, I don't hear any cracking or feel any weird movements in your joints up here, so that's good. Can you move your elbows up and down? Good. Can you circle your wrists and circle them the other way? Good. And then let's do some cerebellar function. So can you take your fingers and touch them to each other with your thumb? Good. Can you go really fast? Good. Now can you take your hands and put them on your lap and flip them really fast? Good. All right, that's good. So now I'm going to push on your shoulders, and I'm going to test that spinal accessory nerve. So I'm just going to have you resist my push and push up, okay? Good. Now, I'm just going to test your patellar reflex. So can you scoot back a little bit till your feet are hanging? Good. I'm going to go ahead and hit right there. Oh, I really got that one. There we go. All right, now I'm going to test the strength of your feet here. So I'm just going to have you resist my push. And I'm going to push up. Good. And I'm going to check cap refill on the toes. And that's less than 3 seconds. That's what we want. All right, now I'm going to move up to your head here. And I'm just going to feel for any bumps or deformities along the head. Oh, not feeling anything like that. Let me know if you have any pain as I touch you anywhere, okay?
Mm-hmm.
All right, now lift up. I'm going to check your ears. I'm just going to feel the pinna right here. And it looks like a nice even skin tone. And I'm just going to peek down your ear canal. Looks nice and clear. A little bit of earwax, but that's okay. And then this one also looks the same as the other side. The ear canal looks good. And now I'm going to feel your preauricular lymph nodes right here. Make sure they're not swollen or hard or stuck out. Same with the postauricular. And those also feel normal. Now I'm going to go ahead and press on your sinuses here. Let me know if you feel any pain. I'm just feeling for tenderness or hard spots or unevenness. And nope, I don't feel that. And I'm going to pull down on your eyelids here. Can you look up for me? Okay, good. Nice even whiteness in the eyes and good red veins in there. Not too many though. Now I'm just going to go ahead and test some your facial nerves, which are nerves 5 and 7. And I'm just going to take this little poker I have here, and I want you to close your eyes. And I'm just going to touch it to different parts of your face. And you're just going to tell me where I'm touching, okay? Ready?
Yep. Left cheek. Forehead. Right cheek. Nose. Chin.
Okay, perfect. Now I'm just going to have you make some facial expressions for me. So can you smile? Can you frown? Can you puff out your cheeks? Can you raise your eyebrows? Good, perfect. Now I'm going to move on to your eyes. So I'm just going to go ahead and test your ocular motor nerve here, and I'm just going to shine a light in your eyes, and I'm going to watch for the pupil retraction as I shine the light in. Ready? Good. I'm going to do it again so I can make sure that both sides do the same thing. Perfect. All right. Now I'm going to do your cardinal fields of gaze test, which is going to test cranial nerves 3, 4, and 6. Okay? And I'm just going to have you look at this pen here, and I'm going to move it, and you're just going to follow it with your eyes. Just your eyes.
Oh yeah, I have it.
Just your eyes. Okay, good. Now I'm going to do some more cerebellar function. So can you touch your finger to your nose? Now will you touch the pen? Back to your nose. Pen. Nose. Pen. Back to nose. Good. Alright, now I'm going to shine my light back up your nose here. And I'm just going to look for even septum. Yep, you got nice moist mucous membranes in there. And the skin looks nice and pink. You're not having any pain while I'm touching here, are you?
Mm-hmm.
Okay. Now, I have a scent here. Don't look. I have a scent here. I'm going to have you close your eyes, and I'm going to have you tell me what scent this is. This is testing your olfactory nerve, which is cranial nerve 1. And this is the scent for the audience watching.
Garlic.
Okay. You were right. It's garlic. Alright. So, Stephen, do you have a gag reflex?
A little bit.
A little bit? Okay, I won't shove this too far down your throat, so don't worry. But I'm just going to have you open your mouth for me and stick out that tongue. Yep, that's good. Cranial nerve 12 right there. And I'm going to have you open again. I'm just going to shine this light in there. Look for nice pink mucous membranes all along there. No, I don't see any sores, lacerations, nothing like that. And, yep, bottom of the tongue looks good. Can you open back up for me? Can you say ah?
Ah.
Okay. I saw that soft palate lift in the back of your throat, so that means that cranial nerves 9 and 10 are functioning. Good. And so now I'm going to move to your neck, and I'm just going to feel your cervical chain lymph nodes down here. Feeling for any swollen ones or hard marble ones. And nope, I don't feel any of that. Now I'm going to feel your submandibulars. Same thing there, and your submental, sorry. Yep, that's the same. And if you don't mind, I'm just going to untie this strap right here because I got to reach your collarbones. So can you lift your shoulders up and forward? And I'm going to feel the supraclavicular ones. And those also feel normal, no swelling or hard spots. And then I'm right here. I'm just going to test your tissue turgor. Alright, that skin bounced right back, so that means your skin's nice and hydrated.
Mm-hmm.
Okay, so now I'm going to palpate your carotid arteries right here. Making sure that pulse is nice and strong and even. One at a time so I don't choke you. And now I'm going to listen to both of them. And will you hold your breath for me while I do this? And I'm just listening for any whooshing sounds, which means that there's a bruit in the artery, which is what we don't want. Okay, good. Those were nice, clear beats. Alright, so I finished the front, but I'm just going to take a peek at my sheet to make sure I didn't miss anything. Alright, now I'm going to move on to the back here. And I'm just going to feel the thyroid gland here, so have you look a little bit that way. I'm going to push the trachea over and just feel right next to it. Seeing if the gland is enlarged or hard in any spots. Are you having any pain?
Mm-mm.
Okay, good. It felt nice and normal. Now I'm going to grab the camera. Skin discoloration and nothing like that. I see nice even skin, and the spine is in line with the neck and perfectly straight. It doesn't curve in any spots or protrude out. And okay, now I'm just gonna have you take a deep breath for me. Okay, so there's even chest expansion on both sides, so both lungs are working the same capacity at the same time. Now I'm going to just percuss along the lung fields, and I want to hear nice resonance, which is a nice clear hollow sound, which means you have nice clear lung tissue. So we're just going to continue and do that. Alright, I heard good resonance throughout the back, so that's good. Now I'm going to listen with my stethoscope here, and I'm just going to have you take deep breaths as I move along the back. Alright, ready? Deep breath. And deep breath. Oh, I apologize. I had the wrong side of my thing on. Can you do that again? There we go. My diaphragm wasn't on. Deep breath. Another one. Two more. Another one. Okay, good. I heard nice clear lung sounds, no crackling, no wheezing. Alright, now I'm going to have you lay down for me. Okay, just grab it by the back. Don't touch anything. There we go. Alright. So, first thing I'm going to do here is I'm going to lift up this pillow, and I'm just going to have you relax and bring your chin up, and I'm just looking for any venous distension in the neck, and I'm not seeing that. No bulging veins, so we're all good there. I'm going to bring this back. Good. And so if you don't mind, I'm just going to slip this arm out of this hospital gown here. And I'm just going to expose the chest here. And I'm going to put a blanket on you for privacy. That's for when I get to the abdomen, but okay. So first I'm just going to inspect the chest and the skin of the chest to make sure it's nice and even. No deformities in the chest or any weird bumps. I see you have a nice big birthmark here. You got that at birth, right?
Yeah.
Has it changed in color or size or shape since you've been born or throughout your lifetime?
No.
Okay, good. So now I'm just going to listen to the different heart sounds of the different valves. And starting with the diaphragm, I'm going to go to the second intercostal space on the right side of the chest. This is where the aortic valve is, or where I can hear it at least. Yep, I heard nice clear S1, S2 sounds. Now I'm going to switch to the bowel to listen for bruits. And nope, still nice clear sounds. And now we're going to hop over to the second intercostal space on the left side of the chest to listen to the pulmonic valve. Switching back to the diaphragm. Nice and clear. S1, S2 sound, switching to the bell. Perfect. Switching back to the diaphragm, we're going to move down to the third intercostal space, which is where I'm going to listen to Erb's point. And switching to the bell. Yep, nice clear S1, S2 sounds again. And now we're going to hop down to the fifth intercostal space to listen to the tricuspid valve. Yep, nice clear sounds. Same thing with the bell, nice lub dub. Alright, so now I'm going to move over, still in the fifth intercostal space over here to listen to the mitral valve. Good, going to switch to the bell. Perfect. And now I'm going to listen to your apical pulse, and we're going to sit here for a minute and I'm going to count that pulse starting now. Alright, I got 86 for that, which is within normal range, and it was a nice regular rhythm. You can slip your arm back in there. Alright, now we're going to move down to the abdomen, so I'm just going to bring your hospital gown up here, and I'm going to keep you covered. So first thing I'm going to do is I'm going to get eye level here, and I'm going to inspect the abdomen. And I'm looking for even contour and symmetry, and I am seeing both of that. It looks the same on both sides. I don't see any noticeable bulging anywhere And I'm unable to see the aortic pulse right here, but that's okay because some people you can't see it and it's normal. Okay, first thing I'm going to do is auscultate with my stethoscope here. So I'm going to listen, starting in the right lower quadrant, moving to the right upper, over to the left upper, and down to the left lower. And I'm just going to listen until I hear 5 vowel sounds. Okay, I hear nice active vowel sounds in all quadrants. So now I'm going to turn to the bell side and I'm just going to listen first to the aorta right here, the descending aorta. And I'm listening for any bruits again, and I don't want to hear anything. Moving to the left renal artery. And now onto the right renal artery. And down to the iliac arteries. Okay. And now I'm just going to come down here to the femoral arteries and I'm just going to palpate and make sure that they are even and regular. All right, good. Now I'm going to listen to both of them. Yep, I didn't hear any swooshing sounds, so that's good. Now we're going to move on to percussion of the abdomen. So I'm just going to be taking my fingers and hitting it in different spots, starting in the right lower and moving my way around. And I'm listening. I want to hear good tympany, which means that we have nice clear bowels and there's no obstructions or dense spots. All right, now I'm going to move to this right side and I'm going to percuss until I hear a dull note, which means that I'm over your liver. And we're just going to make sure it's in the right spot. There it is. I heard that dull note right there.
No, I was like, I can feel it.
Yeah. Okay, so now that I've percussed, I'm going to move on to light palpation. And you just let me know if you feel any pain or tenderness while I do this, okay? And I'm just going to feel for any lumps or any hard spots. Alright, now I'm going to move on to deep palpation. Not having any pain?
Oh yeah, well you turned the fan off last time. I wonder if
Okay, everything feels nice and normal in the abdomen. Okay, so we're done with that. I'm going to move down to your legs. Just going to cover you back up like this. I can take this back from you. Gonna make sure that you can see. Okay. And I'm gonna move the blanket now. So first thing I'm gonna do is feel your popliteal pulses right here. Make sure that they're even. Good, nice even regular beating. And I'm gonna move down to your posterior tibialis right here. Make sure those pulses are even. And then your dorsalis pedis. Yep, nice and even, regular pulse, and then calf refill on the feet in less than 3 seconds, so that's good. And I'm also just going to inspect the skin of the legs and do the same thing I did before, look for any bruising or lumps or moles that I might need to be worried about, any lesions. So you've got some scars on your knees. What are those from?
Probably outside.
Just playing outside throughout
Probably
your
as a
life?
kid, yeah.
Okay, makes sense. Alright, so now I've got a little poker here, and I'm gonna show you the dull side and the sharp side.
Okay.
Can you feel the difference?
Yeah.
Alright, I'm gonna be poking you on different parts of your legs, and I want you to tell me what spot I'm poking and if it's dull or sharp, okay?
Okay.
Starting now.
Right shin sharp. Left knee sharp. Left shin dull. Right inside ankle sharp. Left top of foot sharp. Right knee sharp. I mean dull. Bottom of left foot dull. Bottom of right foot dull.
Perfect. You got 8 out of 8. So, that's good. Okay, so now I'm gonna have you come sit up for me on the edge of the bed. Alright, and then I'm just gonna take another quick peek at my sheet here to make sure that I did not forget anything. I did all that. Okay, I did miss a couple things from the beginning, so. First thing is, I'm gonna have you look at this pen. We're gonna test your accommodation of your pupils. So, I'm gonna have you look at that and then look back here. Alright, good. Your pupils had good reaction to that. And also, I'm going to feel your brachial pulses just to make sure that they're even and regular. Yep, and then the same with the radials. Perfect. Alright. Oh, I am so sorry. I'm so sorry.
Excuse me,
I
nurse.
did not mean to do that.
Oh my god.
Okay, where's your shoes and socks?
That should be illegal.
It was an accident. I apologize. We forgot to tie up.
Lucky I don't sue.
Please don't sue us. Okay, I'm gonna have you put on your socks and shoes for me.
Oh, she's drooping down a little bit.
Mm-hmm.
Damn it.
Language?
Dang it.
You're in the doctor's office.
Sorry, ma'am.
Okay, go ahead and put on your shoes. Okay, Now I'm going to have you stand up for me. And I'm just going to have you close your eyes and stand here for a second. Okay, so your body was not swaying, so that's a sign that you have good balance and you have a negative Romberg. So now we're going to walk to the corner of the room, nice and easy. Perfect. And now we're going to walk heel to toe back to the bed. Perfect. Okay, you can go ahead and sit back down. So I finished our head to toe assessment today, and I've concluded that my patient has a score of 23 on the Braden scale, which means they have no risk for developing pressure ulcers because they have full mobility and muscle function, and good skin integrity. So I'm not worried about them developing any pressure ulcers when they get into that situation. So okay, thank you for being my patient today.
Thank you for having me as your patient.
It was a pleasure.